Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
So this just happened on Monday. Uh, this is the week that they announced the Nobel Prizes. As you know, there's a $1 million prize for global work that is deemed very outstanding. And so this year, the autoimmune diseases were highlighted. As we know, that type 1 diabetes is thought to be caused by uh, autoimmune uh, cells which destroy the beta cells of the pancreas and prevent the secretion of insulin, and also thought to be part of the reason why you get rheumatoid arthritis, which is another example of an autoimmune disease. So this is something that just took place on Monday. The prize for physics was yesterday, and I think today was the prize for chemistry. So. Anyway, so that's what's going on. That's important. Another thing that identified was in the Washington Post, they also had a story on the four vaccines that are linked to a decreased risk of dementia. And they identified those vaccines as the flu shot, the shingles vaccine, the RSV vaccine, and the diphtheria and pertussis, whooping cough vaccine. All of these are associated with a reduction in dementia risk. And so uh, that article emphasized the point that these vaccines are associated with reducing the risk for dementia. Also, talking about the fact that uh, we still should consider wearing masks when we're out in public, that masks have demonstrated that they can be helpful in us giving diseases to others, as well as uh, preventing us from getting it from other people as well. So keep in mind that this is the flu season and the time that respiratory infections are very common. And this is the time for you to get your vaccine uh, for the RSV and for the COVID and for the flu. Any comments on any of those issues that I discussed?
I had a question, Doc, about the RSV. How often do you get that? Is that once a year?
It's thought to be no more often than once a year.
Okay.
So far, some studies have demonstrated that it may be even longer, but at least once a year.
Okay, yeah. I went in for my flu shot and they gave me another COVID shot. So I've had at least 12 COVID shots.
Okay. Any other comments about any of those issues? If not, then I guess we'll can proceed with the first article. This is an interesting article that suggests that a lot of seniors that do not actually go for their preventive care visits, but they will go if if they are related to some concern or complaint that they have. So what they did was they changed the visit from preventive care visit to a specific disease entity or complaint. And they identified that there was an overwhelming increase in the number of people who kept their visits when compared and contrasted with the other group who had no changes in the reason for the visit, but was just a wellness visit. Uh, many of there were a lot of no-shows, but there were very few no-shows. And as a matter of fact, doubling of the people who kept the visits when they were identified with some symptom or disease entity. And so I guess the point they're making is that uh, people tend not to keep their preventive visits, but if you uh, align that with another symptom or something that they fear that this will improve the number of people who actually attend their preventive wellness screenings. What do you guys think about this since you all have the option of getting preventive screenings? Would that work for you, or do you need any other motivation?
It sounds like fear-based
Yeah,
medicine.
yeah. Okay, well, that's what that article is showing that if you can identify a concern, and of course, as you age, there are many concerns. So it's not probably not going to be hard to find concern to use to stimulate somebody to actually keep their visit. Okay, let's go to the next article if there's no comments about that. Now, this is amazing that 75% of the Medicare beneficiaries who were surveyed found choosing a plan is very confusing, more so than ever before. And this is not surprising, except that the number of 75% is extremely high. And obviously, that means that things are very unclear. And of course, with what the new administration is planning to cut the Medicare and Medicaid, it becomes even more important to do what is necessary. Did you guys find a selection or any difficulty in trying to choose a Medicare plan?
I don't know. I just stuck with what I always had. I didn't.
Well, things aren't going to be, uh, things will be different in 2026. That's why it's a concern now, because if they went through with the beautiful bill, uh, a huge number of millions of people will lose their Medicare coverage and Medicaid coverage. And so it then becomes very important to identify what kind of insurance you're going to have. And so that's why 2026 is a critical year.
Mm.
The question is, what will they do now that they know that it's confusing? What will they do to make it less confusing? That's the question that remains.
I have Blue Cross Blue Shield and Medicare, and it's Blue Cross Blue Shield has been very faithful and good to me. And but what concerns me is this Medicare Advantage. My cousin had Medicare Advantage, and it was not working in her benefit, and we had to take her off of Medicare Advantage and put her back into group health or Blue Cross Blue Shield, one of them that we chose. But Medicare um Advantage was just not working for her to benefit her. And it was very, very confusing.
Any other comments or concerns? Okay, we'll talk about this a little. There's another article that talks about what the shutdown is all about. So we'll come back to that. Okay, let's go to the next one. Now, this is an article that says that no level of alcohol use is safe for the brain. And they've done a number of studies, and a number of people believe that anyway, that there's no real safe level of alcohol. But this is a study that went through hundreds of thousands of patients and looked at the brain from another perspectives. Looked at the neuroimaging and other ways and looked at genetic analysis as well. And it includes people of all ancestries, Latin American, European, African as well, which is novel because many of the studies don't involve or they include only people of European ancestry. And so this is a study which had so many patients. I think it was more than 500,000 patients were involved. And so, yeah, almost 600,000 recipients. And so the numbers are staggering. And so it suggests that while a little bit of alcohol may be good for the stomach's sake, it's not good for the brain's sake. And so uh, we know that as that there are many people who drink and have done well, especially our some super ages who drunk until the time they left us. But uh, the data is suggesting that uh, the best amount of alcohol you can drink is no alcohol. But anyway, this is a study that involves so many people that it makes you think twice about uh, not drinking at all. Any comments or questions? This is important for our children and grandchildren who think that drinking is okay. Any comments or questions about this finding? Because we've had many studies that said that one or two drinks a day is okay. This article is contradicting that.
I have a question.
Speak up.
Is this consistent of wine that is pure alcohol?
Ms. Duncan, I couldn't understand you.
Okay, is this conclusive of wine or just pure alcohol content?
I couldn't understand her. Could you?
Barbara, repeat your question, please.
Okay, am I a little bit better now?
Yeah.
Is this study including wine only or with the content of, I'm sorry, alcohol only, but also inclusive of wine, which has a measurable content of alcohol as well?
This is alcohol itself. Any alcohol consumption is what it's talking about. Does that answer your question or not?
Yeah, it does. It includes wine.
Yeah.
All right, my bad. Thanks.
So we have a lot of data out these days that say that one drink a day is healthy. This article is suggesting that that's not the case. So we're gonna believe. Of course, the staggering number of fact that they have 559,000 patients that they studied is impressive.
Dr. Callender, can you hear me all right?
Yes.
My question is, what about people who have comorbidities or illnesses versus people who have no illnesses at all? Well, not no illnesses at all, but very little medical problems. What
Well,
about them and alcohol?
according to this article, it doesn't matter. Based on their data, any alcohol dangerous to the brain.
Thank you.
Now the question is, who are you going to believe? You got all this data out there, and what's attractive about this article is that it does look at Europeans and people of African extraction and Latino extraction. And many of the articles don't have, they have all Europeans, but this has a good mixture. And notice there's an echo.
Caden, for you unmuted, we get the echo.
Okay.
Any other comments or questions? Okay, well, let's go to the next article then. This is an article that looks at the mental health of the United States and finds that Nevada, Arizona, and Alabama have the worst mental health in the United States. Arizona and Nevada have been at the bottom for quite a while, and Alabama's joining them, and apparently southern states, particularly poor in mental health as well. Actually, they had DC as number 11, so it's near the top of the list in terms of having good mental health, whereas these other uh, states that they mention are actually at the very bottom of the list of the worst in the country. And essentially, New York, Hawaii, New Jersey are 1, 2, and 3, and we are number 11, which is not too bad. And of course, mental illnesses. They said 1 in 4 people in the United States have mental illness. So it's a particularly common problem that needs to be addressed as the numbers of people with depression and suicide is ever increasing.
Mm-hmm.
Any comments or questions? They remind us of the suicide number in case anybody's really depressed and needs help. The 988 number has been used for the last couple of years and has been associated with alarming utilization rates.
It appears, Doc, that the number one ranking of mental health and is New York, and DC is pretty high. So that's pretty good for DC, right?
Yes. Any other comments? This has been a particularly common problem for our youth, teenagers, especially since of COVID. Any other comments as this is something that we talk about all the time. One would expect that as of 2026, when the one big beautiful bill goes into play, it'll be even worse. Any comments or questions about this great article? hopefully the stigma of mental health is becoming less and less of an issue, but it certainly is important that we educate our children, grandchildren, and others to avail themselves of mental health professionals when they can. Okay, well, let's go to the next article then. This is a new drug that is now uh, available for major depressive disorders, which is an advantage over the previous drugs. Um, as we've talked about for some time, major depression is a big issue, and many of the side effects of the SSRI drugs have caused a lot of patients to not take their medications, and this then causes them to continue to be depressed. Of course, we also talked recently about the positive effect of electroconvulsive treatment as well as lithium as new treatments for mental health disease and actually for dementia as well. So, so it's important to recognize that we are making progress in having new drugs that are effective, more effective at addressing this huge problem that affects close to 25% of the American population. Now, this study will have to have further phase 3 trial investigations to confirm that it is as good as they say, but it looks like they're making progress on finding new ways of treating major depression. Do any of you feel that the stigma of mental health is any different now than it was, let's say, 10 to 20 years ago?
Of course. I don't know.
What'd you say, Dolores?
I would say I don't know.
Hmm.
It seems like it's more nowadays.
It'd be interesting to hear what your children and grandchildren would say about that, because we know that for us it was tremendous stigma, uh, much more than obesity.
Any feedback coming from me?
Was there a comment?
I said, is there any feedback coming from my computer?
Hmm.
Yes, I hear it. There's an echo when you have when you're unmuted.
Yeah, your voice is clear. Everybody else's voice has an echo.
Echo is so bad, tough to understand.
Okay, we're all good now.
Thank you.
Now it's
Yeah, John, whenever you unmute, we get a lot of echo.
Yeah, I'm hearing echo too.
Any other comment? Now let's go to the next article. Soft drinks apparently are associated with a higher risk for major depressive disorders, and suggesting that we need to stop drinking so many soft drinks. Uh, you see that it says women who drink soft drinks were 34% more likely after 4 years to develop major depression.
Hmm. Interesting.
It's the sugar in the soft drinks that are the problem. Interesting that they identified this in this study in women, but not in men, which is surprising. And they didn't qualify what is more and what is less, but hmm. Interesting study. Time will tell. I'm kind of suspicious of something that says it's only in women.
Mine are sugarless and caffeine free.
Barbara, what did you say?
I drink sugarless and caffeine free soft. What ginger ale only.
Hmm. Any other comments?
No, I definitely don't have any more.
Hmm. Well, they seem to try to justify their findings, but we need more studies like this to see if this is for real or not.
Dr. Callender, this is Sylvia. Good morning, everybody. Um, with so much emphasis on, I think now data that's being misrepresented and all that, now you're saying sodas is affecting the gut. I mean, I understand about the sugar, but it's now okay. Here's another article. Now you're saying sodas themselves are impacting the gut. Is this something new?
Well, studies showing that soft drinks uh, are dangerous is not new, but a study that shows that this is only something that is more dangerous in women is uh, is surprising.
Yeah,
Uh,
and I was just thinking, they said our so much data is either being withheld or not being reported correctly. Like they talk about the job numbers and things like that. I'm like, here we have something else. How relevant is this particular article?
well, I think that this is something that we need to digest and see what additional studies confirm this, to have randomized studies that confirm it or do not confirm it. So this is interesting research that I think with time we can see whether it turns out to be uh, worthwhile or not. Darryl?
Yeah, I wouldn't put this in the category of fake news where you could just pick and choose what you care to believe because you say nothing has any credibility. We've known for a long time that we've got an obesity problem in America, and sugar is a major contributor to that. And if you're
Can
drinking, if you
anybody
have
hear him?
oh, nobody can hear me?
I can
Hello?
hear you. Just need to talk a little louder.
All right, can you hear me now?
Yes.
Better.
Okay. Yeah, I don't think this is something that we could put in the category of fake news that you can pick and choose what you care to believe. Soft drinks become a habit with a lot of people. and I know they like to defend their habit if they like soft drinks, but we've had obesity problem. It's a major problem in the country. If you're a soft drink drinker, that habit can definitely contribute to your overweight or obesity. If it has sugar, there's the sugar-free soft drinks that have artificial sweeteners, and I think there's solid science and data to show um, that artif- the sugar-free soft drinks have an adverse effect on weight. They've been associated with more weight gain. Um, they create the visceral fat around in your abdomen. Uh, so I don't. From what I understand, there's not a lot of good things to say about soft drinks other than people like them.
Okay, any
I
other
do agree.
comment?
I do agree, but the article was talking about soft drinks and depression, I'm like, now that's something new.
Right, and it's something that we need to see more studies on. But yeah, and so you have to take all of these with a certain grain of salt, looking to see what additional studies are done that will confirm or deny its relevance. And particularly, you want to see that the numbers are large. The numbers for this one are interesting when they talk about 300,000 individuals. It doesn't tell us what categories of women they're talking about, what ethnicity or anything else. So we need to have further characterization of the women they studied.
This study was done in Germany.
Okay, it's food for thought, though. So let's go to the next article, please. This is surprising to me uh, that food insecurity is considered a new risk factor for cognitive decline. We know that food insecurity is something that exists, uh, but its association with cognitive decline, which could have been presumed, but not identified before. Now you talk about 5,800 participants that were studied who were 50 years or older. Uh, and so it's going to be interesting to see if this holds up under time, uh, indicating that those people who don't get enough to eat are more likely to have cognitive decline than those people who have enough to eat.
Hmm.
It's interesting. This was a study that came out of Boston. I don't know of any study before that identified the connection between uh, food insecurity and cognitive declines. So if you eat too much, you get obese. You eat too little, you get cognitive decline. Interesting. All about eating the right amount of the right stuff.
Mhm.
Dolores, you had a comment?
No,
Okay. All right. Obesity and Alzheimer's is something that has not previously been linked with Alzheimer's disease, although it has been linked with almost everything else. But this is a new finding that remains to be substantiated. Uh, yeah, I don't think that I've ever seen this before, that the amyloid plaque is connected with obesity. So it'll be interesting to see how this measures up over time. And whether this is associated with memory uh, is still not clear. And so I think this is the first time I've seen a study that says obesity and Alzheimer's are linked. So we'll watch and see. Sylvia?
I mean, we know how plaque builds on the teeth. So they're saying obesity causes plaque on the brain.
Yeah, that's what they're saying.
Mm.
Those are two different kinds of plaque. So
Oh, I'm sure. I'm sure. I was just saying. I know we know plaque on the teeth is one, but now plaque on the brain is just something new.
Plaque on the brain is has been identified in Alzheimer's for some time, but it's the
Oh,
yeah, but it's the first time that obesity has been linked to the plaques in the brain
oh, I
because
see.
the plaques in the brain are thought to be the mechanism by which Alzheimer's affects the brain because it's the amyloid plaques that are laid down in the brain. But this is the first study that says that obesity is a risk factor for that laying down of the amyloid plaques.
Mm.
Oh, I see. Okay.
And the comments on this interesting new association. So much research going on. As somebody mentioned, so much data. Uh, there's so much information and so much misinformation and disinformation but it's good to keep up with what's going on. I guess the bottom line is a healthy diet is a healthy diet. Uh, and the better your diet is, the better off you are, probably.
Makes sense.
Most studies suggest that the plant-based diet is the diet that is healthier than the uh, meat-based diet. But the combination of a healthy diet and exercise and meditation, etc., and keeping your brain active and being socially involved is probably the best thing to do. Let's then go to the next article unless there's additional comment.
Oh, excuse me.
Dolores, did you have something to say?
No.
This is an interesting article that talks about chronic insomnia linked to cognitive decline and elevated dementia risks. So, suggesting that if you have difficulty sleeping, that you need to do something about it. We've had the psychologists to tell us that there is a psychological treatment for insomnia, but that insomnia is does correlate with cognitive decline, and so it's not something that you have that you should continue to suffer from without getting treatment. And there is treatment for chronic insomnia. Darryl?
Yeah, I just read a recent article about special forces in the Army and the armed forces, particularly Navy SEALs, how they can get to sleep in 2 minutes. They're trained to do a technique um, that's based on yoga. They start with the top of their head. They give themselves relaxing words like my head is going to sleep, and then they progress down to their feet. When they get to their knees, they keep repeating "Don't think," which is a form of meditation, slowing down the mental internal dialogue. And so they do that every night, and they fall asleep in 2 minutes. It's kind of a reverse technique from yoga. Yoga starts from the feet and it goes to the head, concentrating on the different chakra points in the body. Uh, but it's the same principle of putting those areas of your sleep, of your body, to sleep progressively, and so that you get into a sound sleep.
Thank you for sharing. Any other comments? Okay, let's go to the next article then. And this again is pointing out that poor sleep quality can increase heart disease risk. And this is a number of studies that non-restorative sleep defined as feeling unrefreshed upon awakening. And that's associated with major adverse cardiac and cerebrovascular events. So that a good night's sleep does seem to be an important for your health, uh, your heart health, as well as all aspects of your health. So a good night's sleep seems to be important. And they call it non-restorative sleep, where you wake up and you're still tired, uh, which is not good. So, any questions about this? Because it's challenging for those who uh, don't get a good night's sleep. Okay, let's go to the next article then.
I had a question, Doc.
You have a question? Yes, Buchanan?
Yeah, are they talking about um, like an overall long-term not good sleep, or like once a week you don't sleep well, having this effect, or
We're talking about long term,
long term? Okay.
not just one night. Yeah, yeah. Talking about chronic. Yeah.
Thanks.
Okay, well, let's go to the next article then. It's an article that suggests that uh, your morning coffee with caffeine can interact with your medications and raise your heart rate and blood pressure. So uh, also, if you're taking anticoagulants, uh, that your coffee can affect that. I don't know how many people drink coffee and then go to sleep, or drink coffee as to wake up. So, uh, how many of you are coffee drinkers?
I am. This is Sylvia. I drink coffee, maybe 2, 3 cups a week.
Oh, that's not much. Barbara?
Yes, sir, but it's decaffeinated.
What was your question?
I said, yes, I'm a coffee drinker, but it's
Okay.
decaf.
Well, it's just important to realize that there are a number of ways in which coffee can interact with your medications. Uh, and this talks about how it constricts the blood vessels um, and they recommend waiting 30 to 60 minutes between taking your medication and drinking your coffee. So,
Doctor,
yes, another comment? So it's just a warning to coffee drinkers to space your coffee and your medications.
you going somewhere?
Suggesting a 30 to 60-minute interval. Okay, I think this is a good article to keep in mind. This is a great article that talked about anti-inflammatory foods because I think somebody talked about the omega-3 uh, and how omega-3 is a good example of anti-inflammatory foods. And these uh, anti-inflammatory foods actually are desirable. And the more you take them, the better off you are. And then this goes on to identify 10 foods that fight inflammation and support long-term health. And they start off talking about uh, tuna and sardines and salmon and olive oil. And then it goes down to berries, which talk about the strawberries, blueberries, and blackberries. And I think John was, uh, Buchanan was talking about his oatmeal and berries that he had this morning. And then, of course, leafy greens that play a great role. And then, of course, walnuts, almonds, and pistachios uh, all are rich in omega-3s. And then turmeric, which is something that we haven't addressed in a while. Darryl?
Yeah, some people think that it's okay to eat a lot of inflammatory foods if you eat the anti-inflammatory foods. I don't know that they balance out, but if you want to uh, avoid having if you want to avoid having inflammation, you need to avoid inflammatory foods, and the top of the list are meats, fried foods, sugary drinks, um, refined carbohydrates that you'd find in white bread, pasta, butter, cheese, and alcohol.
Right. And this is talking about those things that are good for you rather than those things that aren't good for you. Avocados are on everybody's list. So it's good to see, as uh, Darryl pointed out, those which are bad and those which are good for you, to emphasize uh, those which are good for you. Okay, so look at this article as you think of what you're going to eat and drink. Okay, let's go to the next article then. And this article is just fits right along with getting more omega-3s, and as was addressed actually last week by uh, about the fact that omega-3 is anti-inflammatory, and how uh, they provide the antioxidants that are good for you. And this just talks about the foods, mackerel, salmon, herring, sardines, tuna, and all those things. Uh, and the other things that are also good. Uh, as you see, if you don't like fish, still many other ways to get omega-3 without fish. And it talks about those people who are on anticoagulants uh, should think twice about the omega-3 fatty acids. And then, of course, if you have fish with shellfish allergies, that's an issue. John Buchanan?
Yes, I eat a lot of fish, and but I was my previous uh, primary physician told me to take glucosamine, chondroitin, and fish oil, and my current physician told me to stop taking fish oil. So, and I think I took it because I was having like snap, crackle, and pop in my knees. Uh, I guess that's arthritic. But since I stopped taking the fish oil, I haven't really had any snap, crackle, and pop in my knees. And glucosamine, chondroitin also I stopped taking both of those. So I don't know.
Well, I think that there's little doubt that fish oil in general is something that is recommended, but uh, you can do without it. And if doing without it helps, then do without it, because there are many other ways to eat healthy foods and other ways of obtaining the same thing that you would get in fish oils. But if it works, don't fix it. Darryl Armistead?
Yep, you can always get some excellent omega 3s from seaweed. Products called nori, Nori, or spironella. You know, that's where the fish get their where the fish get their omega 3s from.
Thank you for sharing. Okay. Any other comments or questions? If not, let's go to the next article. Oh, yeah, yeah. RSVs is if you haven't had your yearly RSV, now's the time to get it. Just as now's the time to get your flu shot. Uh, and also for your flu shot, be sure to get your double dose if you're over 65. But this is the time if you're over 65 for your RSV and your flu shot. And yeah. Sylvia?
Yeah, last year when my mom went to get her vaccination, and she had the RSV the first year, and then the second year they said she didn't need it, and she just got her COVID and her flu, but they didn't mention the RSV. Um, how often should you be getting the RSV? She's 94, but I was just
Good.
wondering because last year they said she didn't need it.
That's a good question. The data on RSV suggests that uh, it may be operative for more than a year. Now, exactly how soon after a year you should take it is not clear, but it's clear that it's functional for at least a year. There are some studies that suggest it's longer than that, but exactly how long is not clear. But the advice you've gotten from your people, it seems to be consistent with what is in the literature, that it's at least a year. And we're still not sure how soon after a year you need to take it again.
Oh, okay. Hmm.
Any other comments or questions on that? We'll go to the next article. Uh, we're getting close to the articles that are talking about the cutbacks that closing the long COVID clinics, and we'll be closing other clinics shortly. And these cutbacks are going to really begin 2026. But so we are having them now, and they're going to get worse. They're affecting long COVID now. They're going to affect other areas shortly. So, uh, in many ways, the worst is yet to come. As the beautiful bill will cut Medicare and Medicaid coverage for millions of people. Any comments or questions about this uh, this reality of cost cutting that is part of the new administration? More than 11 billion in COVID-related public health funding is going to be lost. And it's called wasting taxpayers' money. That's what Trump calls it. Any other comments about this fact of life for us?
Yes, I'm talking about Trump. He's talking about making America healthy again, right? And by cutting research in health, they're going to that's contradictory. It's insane.
Yeah, it is kind of contradictory. But to him, it makes sense. So what can you say? And we put him in office, so what can we say? Next article, please. This is an interesting new MRI framework, which looks for the long COVID brain lesions that have been difficult to capture, but they now have a new framework that works. So with special MRI studies, uh, most of the COVID brain lesions can be identified and addressed. This is something that is a new development. Sylvia?
I'm sorry, does this address patients who have had what they call the long-term COVID?
Yes,
Uh,
this is for the long-term COVID people, right?
hmm.
Which involves maybe about 10 to 20% of people.
And can you describe long-term COVID symptoms would be just the same? Is it when with long-term COVID, is it, you have a cold every other
Oh, you have
month
more
or
than a cold. It's
uh-huh.
a lot of different symptoms that persist and do not decrease in their intensity uh, days, weeks, and months after you've had a COVID. Some have rhinorrhea that lasts for years. Some have headaches that last for years. They have long-term chronic symptoms that persist for months and months and sometimes years after long after the COVID is gone. Long after COVID, the acute flare-up of COVID is no longer evident.
Long-term loss of taste and smell is another.
Yeah, of course, that's light stuff compared to the symptoms that they have in terms of taste and smell is just a little mild thing compared to all of the other symptoms that they have uh, involving the brain, their lungs, and the GI tract, and uh, the eyes, and so it goes. And the ability to control long COVID is not nearly as good as controlling the acute uh, COVID symptoms. Okay, let's go to the next article, please. This is an interesting article because the hepatitis B vaccine is part of the treatment for hepatitis D. We don't talk about hepatitis D, but hepatitis D is now considered a carcinogen and likely to produce hepatocellular carcinoma, just like hepatitis C and B. The management, of course, is with the hepatitis B vaccine, which would cover the hepatitis C and D. You rarely hear talk about D, but this is the World Health Organization has recognized this as something that is important and emphasizes that the uh, interferon and vaccine for hepatitis B is part of its treatment. We talk more about hepatitis A, B, and C, and rarely ever talk about hepatitis D, but this is something that uh, you kind of can get along with hepatitis B. And so the vaccine for B will treat your hepatitis D as well. You can see here that the hepatitis B vaccine is the treatment. There are no questions. We go to the next article. Darryl?
Yeah, isn't there the hepatitis D vaccine that they give to newborns that Robert Kennedy has said that government wasn't going to pay for anymore?
Okay. All right. Okay. Thank you for sharing. Okay. Um, Now, this is an interesting article on B12 because one of the things about B12 is that it's it's present in meats, but not in vegan diet.
Dr. Callender,
This
your
is
signal was frozen.
often the supply of the vitamin B12. And one of the things with vitamin B12 is that it is important for your blood cells, and it's important for your nervous system as well. And so those patients who have surgeries that eliminate the absorption of B12 will require B12 supplementation. Patients who have celiac disease, short bowel syndrome, and those people who are on a vegan diet and don't take any meat at all of any kind would need vitamin B12 supplementation. Darryl?
Yeah, like the article suggests, taking nutritional yeast to supplement vitamin B12, and I take that daily as a vegan.
Any other comments or questions about vitamin B12, which is uh, not too many symptoms from taking too much vitamin B12. So if you take vitamin B12 at all, it's not going to hurt you.
I have a question for Darryl. When you were talking about nutritional yeast, you say you take it daily. Is it in a liquid form? I thought they were flakes.
They have it in pill form and they have it in injection form.
Oh,
Yep. I take mine as a powder,
My
and
my
I use
my
it.
my
Yeah, I
wife
use it.
had pernicious anemia, and so I had to give her a shot every month. But they have it in pill form as well as injection.
Yeah. As a
There's the
powder, I use
extrinsic
it
factor and the intrinsic factor.
mhm.
as a powder. I use it in cooking recipes.
All right. Thank you. I normally put it on popcorn and things like that, on salads, put the nutritional yeast flakes on things like that. But I was just wondering, you said you take it every day. I was just trying to figure out in a powder form, um, how do you take it every day? But okay,
You can
thank
take
you.
it, yeah. Well, uh, and plus they have supplements, vitamin B12 supplements that are available in pill form as well.
Hmm.
Okay, let's go to the next article then. Well, this is an article that says AI spreads medical disinformation as well as they have deep fake doctors that mimic medical professionals. So social media platform can be associated with good information and much bad information. So, um, and I think has been mentioned before, a lot of this bad information is coming from outside of the United States, and we have to be careful about what we believe and what we see on social media.
So, Dr. Callender, where do we go for good medical information? Do we still
We go to your doctor.
just go to, okay. I'm just
Certainly do
wondering,
not go to social media.
okay. I didn't know if you were going to some medical, websites and instead of listening to social media. Um,
No. The only thing I would avoid is social media.
okay.
Um, um, much of the Google and a lot of that other stuff, uh, you could look at that, uh, but social media is not reliable.
It seems like every commercial or every other commercial on social media is about, oh, you should take this supplement or whatever. It's going to fix whatever's wrong with you. So, yeah, I would definitely avoid. As soon as I see one of those ads, I click off of it because they're only about getting your money and not about really health or anything like that. That's science-based or medicine-based. It's all about, ripping you off.
Let's go to the next article. This is an article on neuromodulation gadgets, which are suggested to take at home. And the bottom line is that without the overall management by the uh, physicians and the provider team, it is not recommended that you do at home stimulation devices alone. Together with physical therapy and other psychotherapy, these neuromodulators can be of benefit, but taking them alone on your own without the additional team effort is not recommended. That's the bottom line in terms of, yes, all of these gadgets from the tens and other things are of value, but not as a standalone. And so this article suggests that you work with your team to take advantage of these neuromodulators, but not alone without medical support. That's the essence of what this article is suggesting. John Buchanan.
I never heard of this stuff. What can you explain a little bit about what it is, what it does?
Well, they have devices that after stroke or after epilepsy or overactive bladders, that they can be used to block the pain after stroke, for block the epilepsy, to block the nerve stimulation, stop the overactive bladder. And all of these can be administered, but they're not standalone. There's something that with the medical team's supervision can be used to overcome these conditions. Uh, does that help you understand what we're talking about?
I'm more concerned about how they work. What what do you actually do, and how do they actually function?
Well, they block the nerve. They
Oh,
block the nerve function.
okay.
That's what they do. They block the nerve function. Uh, uh, because if you've had an overactive bladder and you can't stop urinating, if you have pain that is not controlled by traditional means, then there are people who then get these neuromodulator treatments, uh, which together with the psychotherapy and the physical therapy are effective, but they're not as a standalone. Sylvia?
Yeah, I was just going to say when I was taking physical therapy for my knee, after I had the physical therapy, I think they call it the TENS machine where they
Yeah,
put probes on the area,
yeah.
John, and it pulsates in that area of pain. And so with the physical therapist, she would put the probes on my leg or my leg and put some maybe heat or cold there and for maybe about 10 minutes and then take it off. But I do have to say, she did say that I could buy a TENS machine on Amazon, which I did, but like you said, stand alone, you should do it in cooperation with, let's say, a physical therapist.
That's it.
Thank you for sharing.
That's not like a vibrator, is it?
No, no, it's not like a vibrator. This is a special instrument that blocks the nerve conduction.
So it sends an electrical signal in?
Yes.
Oh, okay. Okay.
Yeah. It's good to be aware of these things so that you take them in conjunction with your medical team, as Sylvia had identified. Fortunately, many of us don't have these problems, so we aren't aware of the important role that these neuromodulators can play when they're used in conjunction with the medical team, the psychologists, physical therapists, etc. Let's go to the next article, please. And this is an article about why doctors sometimes don't refer patients for bariatric surgery, and they talk about three reasons. One is they don't have enough time, they don't have the information, uh, uh, and actually, uh, internists should have time, and they should have the information, and they should refer patients for bariatric surgery as one of the options for management of morbid obesity, and that whatever barriers you have, they should be overcome because there's enough training outside now so that the three barriers that they identify here are barriers which sh actually should no longer exist. Limiting training is not no longer an issue. Stigma should not be an issue, and time should not be an issue. This is something that is state of the art, and the treatment for bariatric surgery for morbid obesity is uh, psychotherapy, uh, uh, GLP drugs, as well as bariatric surgery. And those are the three things that should be uh, discussed with the patient in terms of the options for the treatment of morbid obesity. Then we can go to the next article. This is one of the questions that plagues us today. Why are young people getting cancer? It talks about a 18-year-old girl who has metastatic kidney cancer, which had never been seen before. And so younger people under 50 are getting more cancer than ever before. And we don't know why. Although there's a lot of reason to believe that the chemicals that they're exposed to and the diets that they're exposed to now are more dangerous than ever before. But this is something that is becoming more and more evident that people under 50 are getting more cancers than ever before. And we really don't know the reasons, although we're suspicious that these forever chemicals are part of the reason. They're more exposed, and that the diets that they're exposed to are cancerogenic. So that this is part of the reason. This is something that we're going to be seeing more and more as we uh, look at more of the people who are getting cancer under 50 years of age, which is something that is increasing more and more. Sylvia?
Are they saying those under 50? Is it related to race or whites, blacks, Asians, or
No, we just know it's under 50. Not saying we don't know enough about it to say it's any ethnicity. We know that it's people under 50.
And with these new changes on DEI, will we be able to get that kind of information, like people being able to identify if they're Black, white, or Asian, or Hispanic, or?
We haven't done enough investigation yet.
Mhm.
So time will come, and as we study this more, we will be able to learn more. But I think the forever chemicals and exposure to forever chemicals and products like that are part of the reason the plastics, all those things may be associated with. We haven't studied it enough to give you any answers to your questions. And the questions are many, but the answers are few.
Okay, thank you.
So you're going to see more and more articles on this as time goes on. Next article, please.
Okay, we're all out of the other articles.
Oh, you left out one of the most important articles that I sent, and that is the article that talks about the reason why there's been the shutdown. And the reason for the shutdown is because the Democrats have decided that they are pushing back on Trump. Trump has decided that the beautiful bill of 2020, which should go into effect 2026, will eradicate Medicare and Medicaid for millions of people. And the Democrats have said that they are not going to stand for it. And that's why you have the shutdown, because the Democrats are trying to keep the Obamacare, and the Republicans are trying to eliminate Obamacare. And this then is the big reason why you have the shutdown. And for once, you have somebody who's going to stand up to Trump. Whether this will actually result in knocking out the beautiful bill that knocks out Medicare and Medicaid for millions of people remains to be seen. But this is something that people need to understand as to why we have the shutdown. Any comments about that? The fact that the shutdown is a political ploy in which there's a battle between the Republicans and the Democrats over that one beautiful bill that is going to decrease the Medicare and Medicaid coverage of millions of Americans. Any comments about that? As this will be the last article we discuss, even though it's not there.
No, I think we should just, hope the Democrats hold out.
Well, do you think it's worth the holdout?
Oh, yes. Yeah.
Yeah, I think it's worth fighting for. It's one of those things that
So, Dr. Callender, in your community with medical profession, are they all just saying the same thing, basically?
yeah,
That
nobody's in support of the beautiful bill in
Mhm,
my profession, because it's
mhm,
going to knock out Medicare and Medicaid for millions of Americans.
mhm.
Obamacare is what has been a wonderful thing for decreasing the number of people who have no insurance, and so this
Yes.
is going to take us back to where we were before. And I think that we should fight against it.
It's also affecting, all the government workers, the air traffic controllers, which have to do with the airlines and et cetera. So hopefully they'll get the message. And because they said that they would do it after the Democrats, and they're always quick to say it's the Democrats first, and then the Democrats got to come behind them. But does anybody see the parallel within the centuries? In 1919 around, that was another epidemic virus. 2020, 2019, we got another one. Then there was the stock market crash in 1929, and look like we're heading back again to 2029, or it might be even before that. Has anybody ever realized that or thought about that? The parallel of the centuries, and how we, even with knowledge, it seems like we're spiraling down. And then after that comes a war.
Well, it's going to be interesting to see what happens with this shutdown because um, no one has ever really effectively stood up against Trump, and it's still doubts that anybody will. So um, the Supreme Court is shaky, and so who knows? It may well be what.
One person has stood up against Trump. His name is Epstein in his death.
What was that, Sylvia?
I said one person has stood up against Trump. His name is Epstein in his death. It's that itself is taking him on.
Any other comments? If not, it's going to be interesting to watch and see what Carol's observation is and how things come to pass. Anyway, thank you for a great session and look forward to seeing you again next week. God be with you till we meet again.
Be
Bye.
safe,
you.
everyone.
Yeah, have a good week.
You too.
Hey, Sylvia.
Hey, Miss Tatum, how you be?
Fine. What happened to the lessons?
It's my piano teacher's on vacation for the month of October.
Oh, she actually takes a vacation.
She went to Italy.
Oh, not during
Oh,
the regular time. Other than
yeah,
that, she does it
yeah, yeah.
a
So
month a year.
I need to get down there and practice.
Okay, I know where Charles is.
Yeah.
Okay.
Uh-huh. John, how you doing? Can you hear?
Yeah, he can hear. He's trying to unmute.
Oh, I see. Okay.
Yeah, he's up and around.
Oh, good,
He's
good,
in the,
good, good.
he's in the den.
All right. And his clean desk, right?
Yeah.
Can you hear me now?
Yeah, there's some feedback now, John.
Yeah, that's why they shut me out today. I couldn't say nothing
Okay.
because I was causing echo.
Yeah. It's an echo when I'm talking, but there's no echo when you're talking.
Oh, really? Okay, well,
That's what happened last week. John, you got both computers up.
at first I did, but it's been off for a while.
And then
It's my phone is on, and
we'll turn your phone on.
Maybe the two connected, given the vibration.
yeah, it's one of the two or both. Yeah. So, where is Charles?
Charles is in sewing class. So he, like me, will be listening in the car until we get to 10 o'clock.
Well, tell me about what has Charles said about these air traffic controllers.
What is Charles saying about the what?
Air traffic controllers.
He hasn't said anything.
Well, certainly you got to depend on them.
He may have, but he has not said anything.
Oh my goodness! Did you know that something they said about the air traffic controllers? They could